So all the baseline risk factors we have for Hodgkin lymphoma patients, they do not reliably predict the outcome. So we can't really guide our treatment with baseline risk factors. We have like early stage, intermediate stage, advanced stage disease, yes. And this reflects the burden of lymphoma, and we adapt the treatment intensity to the burden of lymphoma. But within the three groups, we have very different individual prognosis for these patients. So some with advanced stage lymphoma, these patients, for example, can be cured with ABVD only. It's no problem. And maybe it's even the majority of these patients. Others will fail, and we don't know. That's why we can't predict, actually. So that's why we use the PET-adapted or response-adapted approach. So we look at response after we initiated treatment. And if a response with our strategy, with this very intensified chemotherapy, if then the PET is negative and we say, oh, this is a metabolic remission, then we de-escalate treatment intensity. So if you start with ABVD, like it has been done in the English Rethel trial, then you would escalate from ABVD to escalated BIACUP, what we use in order to salvage these patients or to prevent them from relapsing. So we use this de-escalation strategy, PET-guided. And the problem with PET is that we have a high rate of false positive cases. We know that. But in the end, this means that half of our patients with PET-positive finding, we have 40% in our HD21 trial, for example. So 20% of all patients will receive 6 cycles of treatment. They will receive maybe consolidated radiotherapy because it's PET-positive still, which is not necessary. So the PET guidance is good, it's better than what we had before, but it's far away from being perfect. And there have been several abstracts at this year's ASH investigating ctDNA, so MRD marker in the blood, easy to assess, and it seems to be a very valid method in Hodgkin's lymphoma. So the message from this year's ASH is actually that we should undertake all efforts to implement MRD by ctDNA for our patients in order to guide the treatment appropriately and to individualize treatment to the individual patient's needs.